that programs and projects are implemented. We also need to address specific issues about inequality, particularly gender inequality and the empowerment of women. This is an area where quite a lot of action is required. We also will need to come up with innovative strategies to accelerate progress, particularly on the health MDGs, based on the lessons we have learned in the past 10 years. And therefore, all countries we expect should come to this summit in September with what we call breakthrough action plans on how they intend to achieve the MDGs. Civil society has an important role to play in this, both in the lead-up to the summit as well as during the summit itself. They must have their voices heard, and as well as the voices of the poor people, during, after, and even before the summit. They must participate in and influence national level processes by inputting into the content of the outcome document, which we know is being negotiated at the moment. And they must also mobilize citizens and get them to be part of the whole process. In addition, civil society, a key role that we can play is to provide evidence of best practices and use this as a basis for lobbying. The August NGO conference is an important event in this lead-up, though it is coming up almost very late in the day. However, it is important that the conclusions and resolutions arrived at must feed into the summit and into the other negotiation processes. To conclude, let me say this year is the last opportunity for us to refocus our efforts and to ensure focus and direction in order to accelerate and sustain progress. Let us ensure that we make use of this last opportunity that we have. There are no excuses for failure to deliver on the promises that were made. And failure is actually not an option. If we fail, the consequences on the world will be serious, and we shouldn't allow this to happen. Thank you.
Thank you. Thank you so much, Dr. Njai. I think the point that you made about good health being both needing other ingredients and being a summoning of those factors and being a spur to other ingredients, whether it's social or communal or in terms of governance. I think that's something which will resonate through our discussion today, and it's probably an awareness that informed the creation of a wonderful non-governmental group called Physicians for Social Responsibility. And we are very proud to have the president of PSR, if I dare say so.
Yes.
Okay, sorry, Kathy Falvo with us. For those of you who can, please do have a look at Dr. Falvo's blog of a visit to Haiti some months ago. It's fascinating. There are these accounts of rides along long, rugged roads and 30 people staying in a house with 2 bathrooms and this wonderful figure of Big Mama who makes avocado soup. So it's something which I would encourage all of you to read about. And also there's, I think just to go back to the idea of innovation in healthcare, there was this idea of how these wonderful physicians came from the United States with wheelchairs. And there was a lady in Haiti who said, "This is not what I want. My husband has put 2 bicycle tires on a lawn chair, and that serves me much better." So that I think is a metaphor which we should keep in mind. Dr. Falvo, please.
Right, and which turned out to be really lucky for us, because that wheelchair that she didn't want was given to a young man who was a paraplegic before the earthquake, but whose really fine wheelchair had been destroyed by the earthquake, and so he got the wheelchair. His father just happened to be the man who controlled all the incoming donated supplies from the NGO community, and we were so thankful. He went to us, "Go pick what you want." They have these huge pallets of donated goods at the airport in Port-au-Prince, and he said, "You can, anything that's here you can have except for this one pallet which has already been promised," which I will talk about now. How do we get, there we go. Okay, first let me take one minor correction. I'm only the president of New York City PSR. It is a national organization, and some family doc from Wisconsin, the current president. At any rate, PSR, Physicians for Social Responsibility, is going to be 50 years old next year. And I'm going to tell you just a little bit about it because it has to do with this whole concept that we're talking about today. In the end of the 1950s, the beginning of the 1960s, most of you in this room weren't even born yet, much too young or young to remember. There was a Cold War going on between the Soviet Union, or the then Soviet Union, and the United States. And we were both threatening use of nuclear weapons. A group of doctors in Boston sitting around discussing the state of affairs in the country went, you know, there is no, people go out there and they go, oh well, they'll use nuclear weapons and doctors will fix it, whatever happens. And we knew a fair amount of what happened because we'd already used them in Nagasaki and Hiroshima. They went, you know what, there really is no medical response to this, in main part because any bombs dropped on the U.S. will be dropped where all the doctors are. And we have a responsibility to our patients and to the public and the world at large to let them know that you can't be flip about, medicine will fix everything. We will not be able to fix this. And so Physicians for Social Responsibility was born. And a few years later, the same people talking to their colleagues in Moscow came to the same conclusion and started the International Physicians for the Prevention of Nuclear War, which got the Nobel Peace Prize in 1985. Now, the other organization which is the one I actually represented at the UN, is the International Society of Doctors for the Environment. It started with a small group of European family doctors who wanted to help their patients deal with the environmental threats to their health. Meaning, we all sit behind computers all day. If you don't exercise, you're going to get a heart attack. You could grow your little gardens without using pesticides, because pesticides have long-term effects of varying sorts, most of which we don't know, but some of which are cancer. If you happen to be a fetus brewing in mommy's tummy, most of them have potential serious effects to your central nervous system. And so they started a group of doctors there, and in due time went, you know what? This is getting us nowhere. Individuals can try and eat organic and can try to reduce the amount of chemicals they're exposed to, but it's running on a treadmill and losing space all the time because these are societal problems. These are policy issues that allow these chemicals into our environment, and so we really need to get real about what we want to do is protect our patients' health and start getting involved in policy. And here we are. Yeah. Mary Norton started talking about water. The first thing is, when we talk about global health, I think what we really need is health in the sense of the World Health Organization definition, which is to promote those things which keep people healthy, not just cure disease. Yet what I find, in my dealings with people in the world is when you say health in any way, they're talking about curing disease. And as a pediatrician, which is my first training, I'm interested in keeping the kids healthy. I don't want to clean up a mess and keep putting fingers in holes in the dikes. So, among the other things I do, I've been working with a group called Dos Pueblos, which is a sister city project between Manhattan and Tippy Top in Nicaragua, which is right the city next to Managua. They got, and the process is communities within Tippy Top, excuse me, figure out what they need to make their lives better. This is not, we don't come from New York and go, you need running water. They go, we need running water. And to get running water, we need to do a whole series of steps. And Dos Pueblos gets involved when they get to, we need to buy pipes to run the water. and cash is the one thing we don't have. So we raise money for